Hi guys, welcome back again. In this video, I'm gonna be covering another important medical topic which is called asthma. So what's asthma? Asthma is a chronic lung disease, causes narrowing and inflammation of the airways, which many cells and cellular elements play a role associated with airway hyperresponsiveness, lead to recurrent episodes of wheezing, chest tightness, shortness of breath or SOB, and coughing, especially at night and early morning. Variable airflow obstruction within the lung that's often reversible, either spontaneously or with treatment. It affects all ages. And another point, the potential role of indoor and outdoor allergens, air pollution, microbial exposure, diet, vitamin, tobacco smoking, and obesity have been explored. And the development and course of the asthma and response to treatment influenced by genetic determinant and environmental factors. Let's talk about pathophysiology of the asthma. We'll start with AHR, airway hyperreactivity, which is a tendency for airways to narrow excessively in response to triggers that have a little or no effect on the normal individual. Other factors affected likely to be important in behavior of the smooth muscle include a degree of airway narrowing and a neurogenic mechanism. The relationship between atopy and asthma is well established, which demonstrated by skin prick reactivity or elevated serum immunoglobulin (IgE). Common allergen example like house dust mites, pets like cat, dog, and cockroaches, and fungi. Inhalation of an allergen into the airway is followed by an early and late phase of bronchoconstrictor response. In persistent asthma, there is a chronic and complex inflammatory response ensues, characterized by influx and numerous of inflammatory cell and transformation and participation of the airway structural cells and of secretion of an cytokinase, chemokinase, and growth factors. And let's talk about clinical feature of asthma. Clinical feature typically symptoms include recurrent episode of wheezing, chest tightness, breathlessness, and cough. According gender, more common in women. Well, we have to perform an inspection of the nose for nasal polyp because may a patient get a nasal polyp when they have chronic inflammation of their nasal sinuses. And also we're looking for eczema. Patients with mild intermittent asthma are asymptomatic between exacerbation, while a patient with persistent asthma, they are ongoing shortness of breath, wheezing, but these are variable. Asthma being worse in the morning and symptoms may disturb sleep. Cough may be a dominant symptom in some patients with lack wheezing and shortness of breath, so it delay in reaching diagnosis, so-called cough variant asthma. And particular inquiry should be made about a potential allergen like exposure to pets like cat, dog, cockroaches, air pollution, and others. And in some patients triggered by medications like beta blocker, even topically as a eye drop, and NSAIDs, also aspirin. And let's talk about diagnosis of the asthma. First of all, history. and clinically. Then by spirometry, this identifies obstructive defect and its severity with provide a baseline of the bronchodilator reversibility. Then we have a PEF to find diurnal variation, and then if it's spirometry isn't available, peak flow mirror may be used. And then we have a bronchial challenge test, exercise test, skin prick test, X-ray, and CT with eosinophilic airway inflammation. Let's talk about management of asthma. In the first point, we have avoidance of aggravating factors, which is reducing exposure to relevant antigens such as pets, house dust mites, and smoking cessation. And then we have 5 steps to manage asthma. The first one is inhaled short-acting beta-agonist bronchodilators. For patients with mild intermittent asthma with symptoms less than once a week for 3 months and fewer than 2 nocturnal episodes per month, it's usually sufficient to prescribe of an inhaled short-acting beta-2 agonist such as salbutamol or terbutaline. The second step is introduction of regular preventive therapy, regular anti-inflammatory therapy, which is inhaled glucocorticoids such as benzoate, beclomethasone, and mometazone. Should be started in addition to inhaled beta-2 agonist for any patient who the first has experienced an exacerbation of asthma in the last 2 years. The second is report symptoms 3 times a week or more. Third, uses inhaled beta-2 agonist 3 times a week or more. Fourth, is weakened by asthma 1 night a week. There are four points you have to put in your mind in this time. You have to start inhaled glucocorticoids in addition to inhaled beta-2 agonist. Starting dose is usually 400 microgram beclomethasone dipropionate (BDP), but it required a high dose in smokers. The third step of management asthma is add-on therapy. If a patient remains poorly controlled despite regular use of inhaler glucocorticoid, a further increase in the dose of inhaler or inhaled glucocorticoid may benefit in some patients, but in general, add-on therapy should be considered in adults taking 800 microgram per day beclomethasone dipropionate (BDP). And the addition of long-acting beta-2 agonist LABA to an inhaled glucocorticoids provide more effective asthma control compared to with increasing dose of inhaled glucocorticoids alone. The first step of management asthma is poor control on moderate dose of inhaled glucocorticoids and add-on therapy. Then we have fourth addition of a fourth drug. In adult, the dose of glucocorticoid increases into 2000 microgram beclomethasone dipropionate, and nasal glucocorticoid should be used in a patient with prominent upper airway symptoms. Leukotriene receptor antagonist plus long-acting plus thiophyllene or slow-release beta-2 agonist may be considered, but if a trial of add-on therapy is ineffective, should be discontinued. The fifth step or final step of management asthma is continuous or frequent use of oral glucocorticoids. Prednisolone therapy, single daily dose in the morning, should be prescribed in the lowest amount necessary to control symptoms. The risk of osteoporosis in this group can be reduced by giving bisphosphonate. And now let's turn to know what's exacerbation of asthma. Exacerbation of asthma means increased symptoms, deterioration of lung function, and increase in airway inflammation. Most commonly precipitated by viral infection, and most attacks are characterized by gradually deterioration over hours to days. And now let's talk about management of mild to moderate exacerbation of asthma. We have a short course of rescue glucocorticoids, which is prednisolone 30 to 60 milligram daily, are often required to regain control. So now we have indications for a rescue course include: the first one is symptoms and peak expiratory flow PEF progressively worsening day to day. The second one is onset or worsening of sleep disturbance by asthma. The third is progressively diminishing of response to an inhaled bronchodilator. Fourth one is persistence of morning symptoms until midday. The fifth one is the symptoms are sufficiently severe to treat with nebulized or injected bronchodilator. And let's turn to know management of acute severe asthma. First of all, we have oxygen, high concentration. When we have failure to achieve appropriate oxygenation is an indication for assisted ventilation. The second one is we have a high dose of inhaled bronchodilators, short-acting beta-2 agonists, the agent of choice, ipratropium bromide plus salbutamol for life-threatening or acute severe asthma. Chest X-ray is not necessary unless when you suspected pneumothorax. And the third one is systemic glucocorticoids, prednisolone usually given. Let's turn to know indications for assisted ventilation in acute severe asthma. We have coma, respiratory arrest. The third one is deterioration of ABG tensions or arterial blood gas tensions despite optimal therapy, which is partial pressure of oxygen below 60 millimeter of mercury, and partial pressure of carbon dioxide or CO2 more than 45 millimeter of mercury, and pH low. The fourth one is delirium and drowsiness. That's all about asthma that I mentioned in this video. I hope you got a benefit from it. I don't have anything, just don't forget to make dua for me. Thanks for watching.